Okay, well, fantastic. So as we're getting our slides ready, good afternoon and welcome, and thank you for spending the afternoon to talk about healthcare with us. So I'm very excited about the opportunities to share with you what's happening in the market. I'm really going to try to focus a little bit on the industrialization of healthcare using the visualization techniques and modalities that you've heard about today. So Bern, thank you for having us today. It's been a pleasure and looking forward to the discussion after the session here. So just to get a little bit of a sense of what we do and why this is so important at Cisco, we really believe the whole concept of the human network, which includes voice, video, and data, will transform the way we work, live, play, and learn. Very appropriate, certainly, for the healthcare topic we're about to embark on. I just want to kind of share with you that we've had a good opportunity to work both at the government level, the private level, to look at these technologies. We have our own healthcare facilities worldwide, here in the US, and across the globe in India and China, and in Europe. So what I'm sharing with you today, we actually use for our own employees, and we've had a good global sense of how it's being adopted. So one of the things I'd just like to share with you is, we believe that there certainly is a technology avalanche. So it's not about the opportunities, but it's about how we can commercialize those opportunities and make them part of everyday care. The second thing we're going to see is it's also about the information. So combining the video, the voice, the data, and the information at a point of service is really where the breakthroughs are going to happen. And the last part of it I just want to kind of highlight here, it's going to be about personalization and reducing complexity. It's wonderful to talk about all the things we can do at population levels, but what's going to be very important and interesting is how we can actually deliver that at the point of service for a particular patient. So one of the things we've seen is we have to be very sensitive to different trends in healthcare because we, of course, cover all the generations. Whether we're a patient or whether we're a consumer about to use the healthcare system, we consume technology in different ways as we've seen. So, for example, the greatest generation likes to use more direct communication styles. Baby boomers are more about engagement, know me, share with me. Generation X and millennials, our children and our emerging generations now, are very much about self-control and collaboration, very quick transactions. You all have teenagers like me, I'm sure. You'll see that it's hard to have a conversation with them. It's more about texting and collaboration using some of the modalities like Facebook and YouTube. So it's not about which one is right or wrong. It's about which one's appropriate for the individual and the personal experience. So in healthcare, when you start to apply these different generations, you start to see that people, for example, use this in different generational decisions around how they, for example, use physicians. So greatest generation of baby boomers choose physicians as really the primary direction of how they would go to a hospital. Whereas Gen X and millennials, it's all about reputation, things that they'll do through research and online training. So this is a very important aspect to understand when we think about visualization and how we're going to use that. In our own company, the people we've hired in this younger generation have really forced us to accelerate the learnings and the use of these technologies. People like me like email, right? So that's probably going to be something we're all going to have to transition to very quickly and use some of the video modalities. So the inevitable realities I just want us to consider for today, this concept of the borderless network. It's not just about the capabilities on our own four walls, but it's the capabilities across the community and throughout the globe. It's all about the experience. If it's too hard, too difficult, too inconsistent, it won't work. Payment is going to be linked to value. So if you want to get financial incentives for people to use telemedicine, for example, we have to be diligent about the value. And that's probably one of the biggest hurdles right now in our industry. And finally, I want to kind of cover briefly social care and what the enterprise needs to do. So the concept here is we believe that the infrastructure to support this is going to be our next fourth utility. Just like electricity, water, and gas. And look at some of the social upheaval now in the Middle East, right? It was really brought upon by the connectivity. And when people turned off the internet, you actually got a lot of social unrest, just like we would today if we turned off the electricity in this building. So the infrastructure that we use to power visualization is really something that's going to become necessary, not optional. The other part of it is about data. So the concept of being able to route and create multiple experiences, create a personalized view, and route it to these video endpoints is really what the network is starting to do. So as we do more and more with video, it's not just about the video, but it's connecting it with the appropriate data elements. So I want you to think about that, and as we think about institutionalizing this, this is what the healthcare service exchanges are essentially going to be built on. And then finally, the human network is really about solving these problems: capacity, collaboration, the concept of exchanging information, and creating a personalization model. If we don't solve for those things, we're not really making a difference around the business and the ROI models. So what I'd like to kind of give you a little sense of, there are incredible opportunities for productivity in healthcare. Just by being able to untether people and to use a mobile device like a smartphone and to push video and information to it, we've seen some tremendous opportunities. We can improve service time by about 30%. So think about that if we're trying to reduce cost in healthcare. The other thing we're starting to see in this slide, it's really about wasting communication and trying to turn that back into a financial message. So right now we have a lot of snippets of what I call incomplete information to try to put together the piece of the puzzle. What if I could talk to the provider, talk to the referring physician, see the data that they see, and interact with them as if they were in front of me in the room? We think we can make a big impact on wasted communication. And finally, I think you're going to see, again, more and more of these case studies. We've seen this globally. We've done it in Australia, New Zealand, even in Nottingham Hospital. The concept of that efficiency, we can actually get one more FTEs out of each shift through this efficiency. So I encourage you, as you think about the business reasons, to be very mindful of these things. Okay, so the megatrends. We think that there's definitely advanced telemedicine, experts on demand, and virtual assistants. So I'm just going to kind of cover these very quickly. What's exciting here about using the visual capabilities, there are so many video screens now around the globe. What if we could tap into every one today? What if we had applications that we could use cameras and use the existing screens? Look at all the screens that are on in this room right now. We should be able to use those and tether to them and create that as a communication network. Personal. There are a lot of personal devices that we're also not leveraging. Again, many of them with cameras. I have 2 in my pocket right now with 4 cameras on them, right? That's a lot of cameras, but I'm not using the cameras right now. I use them for cell phone and email because I'm an old guy, right? Social. Concept of Facebook and Google are fantastic. They've moved us into a model. In healthcare, we have to think about how to use those tools in a secure and reliable manner. Those are the challenges we have to solve for. And finally, augmented. It's not just about the video that I see, but it's about providing additional data, creating an enhanced experience. And I'll give you examples of real improved satisfaction data. So for example, when I start using the concept of basic multitasking, look at the way we're actually using all these capabilities today: TV, PC, walking, and basically work hours. Passive networking is using ambient video, online backup, software update, internet PVR video. There are a lot of things that happen in the background that we don't even touch. So what if we could start using our video collaboration to work in the background and serve us up information in non-real time as well as real time? So think about that opportunity. And then finally, this concept of visual networking, we really believe it does increase trust. It doesn't take away trust. I love the example I just heard about the visual tracking of the eyes. Those are the cues that we need to increase trust, not just the video alone. The other thing is everything is a surface. Everything could be a surface. We could create a surface here. This wall could be a surface without the screen. So the idea of video being everywhere is really a possibility today. And finally, the concept of time shifting I just want to touch on. It's not about the real time. It could be about future time. We're doing a project now in Palo Alto with our medical clinic. And what we're actually doing in dermatology consults, we're capturing the consult, recording it, sending it to the dermatologist after hours. They're sending back the video response with a prescription. Doesn't have to happen real time. Build efficiency around the time that you have. So finally, again, there's some very good studies that demonstrate that visual information can actually improve patient care above and beyond the regular studies. We've studied this in Scotland. We've seen it here in the Mayo Clinic. And these are several other studies around informed consent, video chemotherapy, melanoma, and education around heart failure patients. Again, better than the normal communication we get face-to-face. So what I want to think of here is there is a spectrum. And this spectrum goes from low to high. This is actually a very usable spectrum for us, email, voicemail, and chat, all the way to full immersive telepresence, and everywhere in between. So what I think we need to think about is how you move up that spectrum, what the value is for each of the transactions, and what the cost is. So I'll give you an example in healthcare. A reimbursement for telemedicine, for telepsych in Georgia is about $20. A cardiac consult is probably going to be $150 to $300. Very big difference. I'm going to choose different modalities based on my economic model for each of those. So I'm going to just share with you some of the outcomes of the high-end model, because I think that's an interesting one. We are using this here in the United States. It's an FDA-approved Class 1 medical device. Believe me, there's a lot of complications. We could spend a whole day on the different regulations. But what's exciting about this, it's an immersive concept, high-definition video, simple user interface, one touch to connect, real-time analytics, and using the information around the scope. And in addition, we found also ways to create an extensible retail model. This is a kiosk. We can put this in a freestanding location. You get the same access to services, and you can even find out who is going to be on the screen before you walk in through a digital sign. So very exciting, very good way to extend the reach and to create virtual clinics. So how has this been received? Very well. The study in Aberdeen as part of the Scottish Centre for Telehealth yielded a very high satisfaction rate, patients from 16 to 75, good male and female mix. This was actually setting up a unit like that outside of the emergency department after hours. Here in the United States, as part of our FDA approval, we did the pilot here in San Jose. Now we're using it across the US. Very effective also, 97, 98, 90%. And what was interesting, we actually found the physician concordance rate of the diagnosis to be higher using telemedicine and the video modalities than a face-to-face visit with two different doctors in a controlled group. So very interesting. We're getting to a point now where it's not only as good, but in some cases even better. Finally, what we have to also get away from here is connecting everything with the hard wires. This should be wireless. This should be cloud-based. There are a lot of things that we're already pushing into the cloud, including that video modality. So the idea is we want to make ubiquitous access everywhere with 4G, and who knows what's coming after that. The definition capabilities of compressed video. This is something that is ubiquitous now and will become more ubiquitous in the future. So finally, where this all comes together, this is our notion of the health services exchange in the cloud. Using those capabilities on the last slide, being able to create real-time connectivity with a variety of care capabilities, high-end all the way to low-end, and creating the data aggregation across multiple networks without actually having to transport the information into common databases. That's the vision of the health services exchange. We've got a good start of that here in the US. We announced a partnership with United Healthcare at the HIMSS conference this year. And we have already people that are building applications onto this exchange using video, voice, and data exchange. So with that, we think there's some great solutions here. But again, the idea here is personalization, information exchange, collaboration, and capacity. Those are the business reasons we're solving for it. Okay, I'll be remiss if I don't talk about social networks for the sake of our children, right? They like to use social networks. The idea here of social networks, this is something that we see is actually becoming relatively uncontrolled. And that's good. Here's an example. This is actually in Clay Shirky's book, Here Comes Everybody, where he talks about people organizing in social networks to do healthcare research. And they're self-reporting, and they're sharing examples and showing video pictures of their own conditions. Wonderful examples of things we're going to see in social media. The other thing we have in Christakis' study, we actually find that social networks are actually an indicator of healthcare disease states. So in this example, he actually linked the probability of obesity based on your social network relationships. And not only is that probability more consistent, it's actually more consistent than your spouse's relationship. So that's a very interesting question, right? So you're going to find a lot of these social networks kind of evolving into a place maybe we haven't thought about. So for us, social networks are also a place for visualization. And the concept of being able to create video cues, real-time videos, real-time connectivity, and access to information in a personalized manner, we believe is going to be the way to unleash the power of video in this ubiquitous endpoint device world that we're seeing. So this is actually something we are using inside Cisco. It's called Cisco Quad. We're deploying it now across a variety of enterprises. I've had two very exciting discussions with communities of healthcare interest, both in autism, ironically. One of them with UC Davis, and one of them in Georgia Tech at Emory University also. So very exciting to see how this is actually going to create a social network with the capability of real-time visualization and personalization. What's nice about this, too, is there are going to be other capabilities of visualization, not just people, but people who represent our likeness. And this is certainly something that we've been working with. We've actually created Nurse Hallie to do registration features and capabilities. What's interesting is Nurse Hallie has certainly evolved extensively. This is actually an avatar that looks real. From our research, we found that the closer you get to a real avatar, the less acceptance you get. So there is a place where people are accepted versus not being accepted. So I welcome all the research I'm sure we're going to get out of our colleagues in this room in this area. And finally, for us, we also think just making video available real time is going to be a big enabler. So in this example, this is just a retail example. You can get, sorry about that, access to somebody online. You can quickly talk to them, touch, and connect. The other thing I just want to share with you is the home. We think the home is a huge frontier. I know a lot of our peers are working on ways to get to the home. This is an example of something we just released this year. It's called the Cisco Yumi. It's deployed through your local Best Buy store. And it is a very low-cost capability you can attach to your existing TV, and you get immersive high-definition video through a wireless router. This sells for like $300. So imagine where this is going. This will probably be embedded into cable TVs and other set-top boxes very quickly, and you'll be able to connect to your high-definition video. And then finally, certainly tablets and mobile devices being secured. Everybody's kind of moving in this direction. The beauty of this is it's going to be the collaboration space of voice, video, and data. You need all three. So with that, I just want to kind of thank you for your attention and give you a little bit on some of the new projects we're doing. You may have heard about these. Connecting the Sichuan province was actually putting these devices on trucks where you actually have an immersive healthcare experience. And again, the network of the voice, video, and data is something we can connect throughout the enterprise. So you're going to see more and more of these advances in a lot of our countries that are really investing heavily in healthcare. So with that, I think we're right on time. Thank you all. Looking forward to the discussion.